Switch to safer. Switch for good. Introducing CryoDose TA, a fast-acting topical anesthetic spray designed to deliver immediate pain relief right at the point of care. Safer, better, and more cost-effective, CryoDose TA helps clinicians manage pain quickly during everyday procedures. CryoDose TA works by rapidly cooling the skin to create a numbing effect, helping control pain from injections, IV starts, venipuncture, minor procedures, and even sports injuries. It evaporates instantly, leaving no residue. Just fast, temporary relief when patients need it most. With a 360-degree spray, you can apply it at any angle. It's non-toxic, non-flammable, and safe for use on intact mucous membranes and minor open wounds, making it a reliable choice across a wide range of clinical settings. Step 1. Prep the site following your standard protocol. Clean with antiseptic and have all equipment ready. Step 2. Hold the can 3 to 7 inches from the treatment site. Step 3. Spray steadily for 4 to 10 seconds. Stop if the skin turns white. Step 4. Perform your procedure immediately. The anesthetic effect lasts up to 1 minute. Reapply if needed. Aim for an average spray time of 5 to 7 seconds. This typically provides effective cooling without over-application. Pro tip: to maximize performance and get the most out of every can, rotate the nozzle a half turn and hold the can more upright, especially as it empties. This helps the internal tube reach remaining contents for a consistent spray. For fast, reliable pain control with built-in safety and efficiency, choose CryoDose TA. Designed for ease, built for value. Learn more at nuancemedical.com/CryoDose TA.